rude in stopping you before the end of your prepared intervention. The next speaker inscribed on our list is from the Ukraine, the Institute for Demography and Social Studies. You have the floor.
Уважаемые дамы и господа, говоря о проблемах гендерного неравенства, я бы хотела отметить несколько особенностей Украины. Первое – это связано с тем, что женщины в Украине гораздо более образованы, чем мужчины, особенно в молодых и в средних возрастах. Женщины доминируют также в составе студентов университета и иных профессиональных учебных заведений. И, наконец, женщины в Украине очень хорошо представлены среди врачей и учителей, включая преподавателей высших учебных заведений и университетов. Если мы посмотрим на этот слайд, то вы увидите, что практически постоянно безработица среди мужчин несколько выше, чем среди женщин. Понятно, что тут есть некая статистическая ловушка, связанная с разницей в пенсионном возрасте. Хотя нам удалось добиться повышения пенсионного возраста для женщин с 55 до 60 лет, но этот период растянут на 10 лет, и поэтому пока еще реакции нету рынка труда. Но, тем не менее, обратите внимание, в 2009 году, с началом кризиса, резко возросла разница именно в безработице мужчин и женщин. Это связано, в частности, с тем, что мужчины больше представлены в тех отраслях, где выше зарплата. Промышленность, строительство, транспорт. Но эти же отрасли гораздо сильнее зависят от конъюнктурных изменений рынка труда. Именно поэтому так и получилось. Женщины, в отличие от мужчин, гораздо больше сосредоточены в отраслях так называемого государственного сектора. Это здравоохранение, это образование, в какой-то мере это и государственная служба. Однако, обратите внимание, в первой категории, то есть это высшие должностные лица государства, и на уровне местной власти, и на уровне государственного правительства, женщин гораздо меньше, чем мужчин. И в отличие от этого, женщины представлены больше, чем мужчины, в пятой, в шестой категории, то есть это клерки, которые не принимают решений. Этот слайд очень четко демонстрирует наличие некоего стеклянного потолка. И, в общем-то, именно с этим, а частично еще и с тем, что женщины меньше представлены в тех отраслях, закономерно меньше, где больше занятость в опасных и вредных условиях, это объясняет различие в заработной плате 23-25%. Лучше у нас не получалось. Вместе с тем, как и обычно, во всех странах женщины гораздо больше заняты внутрисемейными обязанностями. Но в отличие от других стран, у нас женщина не только больше работает по дому, она распоряжается семейным бюджетом в большинстве случаев, она принимает решения относительно того, где учиться детям, как проводить отпуск, какие приобретать покупки и так далее и тому подобное. Таким образом, совокупная женская ответственность в Украине больше, чем мужская. К сожалению, это можно уже не показывать, к сожалению, общество не воспринимает вообще гендерных проблем. Достаточно сказать, что единственная из целей тысячелетия ЦРТ до 2015 года, по которой нет вообще никакого прогресса, это как раз гендерное равенство. Когда мы определяли в процессе консультации приоритеты развития Украины после 2015 года, гендерный приоритет вообще не вошел в список 12 приоритетов. А когда мы проводим обследование социологически общественного мнения, выясняется, что даже женщины не слишком-то озабочены своим положением. То есть налицо непонимание, общественное непонимание вообще наличия проблемы. И в этом контексте я бы очень хотела обратиться к опыту Франции, к опыту Швеции и, следовательно, попросить международное сообщество лучше поддерживать гендерное движение как в Украине, так и в других странах, где есть эта проблема. Спасибо за внимание.
I thank you for your statement, and I now give the floor to the organization Kyrgyz Indigo.
Thank you. Dear conference participants, I'm Dastan Kosmamytov from Kyrgyzstan, and I'm honored to give this speech as a youth delegate and want to highlight major recommendations from regional youth forum in Istanbul, which recently gathered young activists from 40 youth organizations across the region. First of all, we are not a homogeneous group. Rather, we are very different and diverse from sometimes extremely contrasting social and cultural backgrounds, educational levels, and economic status. Among us, there are many young people who suffer everyday humiliations, injustice, discrimination, and violence from their friends, families, neighbors, classmates, local authorities, and state institutions. These extremely vulnerable and marginalized youth groups include young people and adolescents with disabilities, with low socioeconomic status, young people with diverse social orientation, gender identities, and expressions, from ethnic minorities, indigenous First Nations, and traveling communities, including Roma, living in rural areas, living with HIV and AIDS, and also young drug users, sex workers, out of school, migrants, and refugees. Our needs and realities intersect and overlap. For example, I have a young transgender friend with a disability from a small city of Vosh in Kyrgyzstan, who, due to stigma and discrimination, can access education and health services. She lost her mom, who was trying to protect her child from a transphobic person and was killed by him. Many other people experience stigma, discrimination, or violence, or even are violently killed in the region when states fail to respect our rights. It's essential, therefore, that our governments respect our diversities by recognizing our multiple needs and realities in rights-based laws, policies, and programs. The special attention should be also paid for young human rights defenders who advocate and protect the rights often in unsafe environments with corrosive national regulations, including intimidation, torture, and unlawful detention. In our region, there are still thousands of cases when human rights of young people are violated, and often violence is justified on the basis of cultural traditional and religious values and practices. The resolution passed by the UN Human Rights Council in 2012 calls for promoting human rights and fundamental freedoms through a better understanding of traditional values of humankind. This ignores the dynamic nature of traditional practice, undermines decades of rights respecting progress, and allows countries to use traditional values as a tool of oppression and structural violence. We want to be clear. We respect our cultural, traditional, and religious values, but they should not contradict our basic human rights. Therefore, it's very crucial that governments harmonize their national laws with the requirements of ratified international human rights conventions and implement effective monitoring and accountability mechanisms to ensure young people can report and seek remedies and redress. Human rights are human rights everywhere, from Seattle to Bishkek, and human rights has to be seen not as a Western value, rather as a universal value of the whole humanity. We call for recognition of our sexual rights as human rights. This includes our right to a safe, satisfying, and pleasurable sex life, to make informed decisions regarding our bodies, our bodily integrity, and our freedom to decide if and when to have children. It also includes removal of mandatory and coercive HIV, STI, and pregnancy testing, mandatory waiting periods for abortion services, parental and spousal notification and consent for accessing SRHR services. Additionally, governments should implement appropriate anti-discrimination mechanisms through which incidences of discrimination, hate crime, and coercion can be reported and addressed. To ensure the work of such mechanisms, governments, civil society, and UN agencies must provide rights-based sensitization trainings for law enforcement agencies, medical professionals, and other stakeholders. Criminalization of sex workers, people living with HIV, and people with diverse sexual orientations, gender identities, fuels and fosters violence against them, hinders the ability to maintain their physical, sexual, and reproductive health, marginalizes and socially isolates them, and fosters discriminatory practices against them. That is why the criminalization of abortion, sex work, HIV status, sexual orientation, and gender identity is crucial for securing human rights of the most vulnerable groups of young people. Governments must eliminate sexual and gender-based violence, early and forced marriage, domestic violence, marital rape, other forms of violence, with particular attention to ensuring the rights of adolescent girls and young women to safety and bodily integrity. These laws must be supported by policies and programs focused on prevention of violence and guaranteeing access to justice for victims of violence. Our central recommendation is that governments integrate a human rights-based approach to all laws, policies, and programs, particularly population and health-related policies and programs, to ensure that our dreams come true. Thank you.
Thank you very much for your statement. I now give the floor to the Rutgers WPF.
Thank you, Madam Chair. Distinguished delegates, ladies and gentlemen. First, I would like to support the statements made by UACT and the Youth Coalition yesterday, as well as those made today by the various youth participants, including the one from Kyrgyzstan just now. And secondly, I want to thank Madam Bousquet as well as the two discussants for their interesting presentations. Inequalities in access to income, property, natural resources, political power and social services affect people's health and the realization of their human rights, including their sexual and reproductive health and rights. This is also true the other way around. Unequal and inequitable access to SRHR constitutes a significant barrier to inclusive social, economic, and sustainable development. It is an obstacle to achieving gender equality and women's empowerment, impedes the participation of the most marginalized social groups, and reinforces existing inequalities. We've heard it a number of times here today, but universal sexual and reproductive health for all cannot be achieved without respecting, protecting, and fulfilling human rights. And without realizing sexual and reproductive health and rights and addressing inequalities, the Cairo Programme of Action and its key actions will remain far from being realized. Therefore, I would like to make a number of recommendations. First, to clearly acknowledge the importance of a rights-based approach to health, including SRHR. Secondly, to give an additional push towards making SRHR real by, first of all, addressing inequities and inequalities in policy planning, development and implementation, through a focus on the most marginalized, such as women, adolescents and young people, people with disabilities, people with diverse sexual orientation and gender identities, people living with HIV, and sex workers. They should be meaningfully involved in all levels of decision-making. To give an additional push towards making SRHR real by including comprehensive, evidence-based and rights-based sexuality education in school curricula and providing equitable access to sexual and reproductive health information and services, including youth-friendly services. To give an additional push by increasing efforts to prevent sexual violence against people with a disability, to ratify the Convention on the Rights of Persons with a Disability and its optional protocol, which allows for individual complaints. To give an additional push by including recognition of youth sexual aggression and victimization. There is ample evidence that youth sexual aggression and victimization is highly prevalent in many European countries, and that young people's sexual health is strongly endangered by it. However, there seems to be a blind spot regarding this issue. To give an additional push by including sexual and gender diversity in government policies and their implementation. Recently, several exploratory investigations on safety, freedom and visibility of transgender persons in the Netherlands were done. Results indicate that transgender persons often face social exclusion and run the risk of being violated and/or harassed on the basis of their gender expression. There is reason to believe that this is not any different in other member states of the ECE region. To give an additional push by decriminalizing homosexuality, abortion and sex work. To give an additional push by stimulating new forms of masculinities, together with men and boys, women and girls. more attention should be given to the positive roles men and boys can play and are actually playing in improving gender equality. And as final point, which as far as my knowledge has not really been addressed yet, to ensure that the ICPD and the outcomes of the ICPD Programme of Action review process are included in the post-2015 development agenda. Thank you very much, Madam Chair.
Okay. I thank you for your statement and now give the floor to the Sexual Rights Initiative. 5 minutes max, please.
Thank you. Good afternoon. I make this statement on behalf of the Sexual Rights Initiative. Social, political, and economic inequalities impact on the realization of individuals' sexual rights. Achieving the highest attainable standard of health becomes difficult when structural inequalities, including legal and policy barriers and social exclusion, prevent individuals from accessing basic services, including sexual and reproductive health services. Social inequalities related to gender and sexuality disproportionately affect adolescents and youth, women and girls, and individuals with diverse sexual orientations, gender identities, and expressions. Adolescents and youth experience inequalities, particularly in regard to the realization of their human rights, specifically their right to health, education, privacy, equality, and to be free from all forms of stigma and discrimination. Inequalities stem from the fact that adolescents and youth are not recognized as sexual beings by parents, caregivers, teachers, health workers, and policymakers. Sexuality is a central and intrinsic aspect of every human being from infancy onwards. Unfortunately, a combination of social taboos around sexuality and age-based inequalities marginalize adolescents and youth in terms of claiming and exercising our sexual and reproductive rights. Inequalities also often manifest as a result of discrimination and harassment based on a wide variety of factors, including pregnancy, sexual orientation, marital status, disability, race, ethnicity, HIV status, and leads to negative education and health outcomes. Adolescents may need to obtain consent from their parent or guardian or partner for medical treatment in general, as is the case in many states, or specific sexual and reproductive health services, including legal abortion services. Fear and stigma often deter adolescents from obtaining such consent, and as such, they may forego seeking information or accessing a service. Individuals with diverse sexual orientations, gender identities, and expressions face inequalities and exclusion in the form of stigma, discrimination, and violence, and also may be deterred from accessing sexual and reproductive health services and information. These inequalities and human rights violations are rooted in patriarchy and the resulting heteronormativity and gender norms, which place limitations on what is acceptable sexual behavior or appropriate family formations, and socially constructed characterizations of femininity and masculinity. These impact upon individuals' ability to freely express their sexualities and live free from stigma, discrimination, and violence. Women and girls continue to face inequalities and social exclusion on the grounds of ideological barriers to acknowledging their right to have control over their own sexuality. Women continue to be denied their right to access modern methods of contraception, or similarly have their right to life denied, as women continue to die from preventable pregnancy or childbirth-related complications, or when they are subjected to so-called honor killings. These human rights violations present society and government strong resistance to recognizing women as sexual beings deserving of respect, protection, and fulfillment of their sexual and reproductive rights. The sexual and reproductive rights of young women and girls in particular continue to be violated. Harmful traditional and cultural practices have been used as justification to uphold female genital mutilation, early and forced marriages, both of which practices are in direct violation of the right to bodily autonomy. It is therefore essential that a rights-based approach underpin all future development efforts. Addressing forms of inequality which can result in social exclusion requires that laws, policies, and programs employ a human rights-based approach that prioritize empowerment and capacity building of marginalized communities and the establishment of mechanisms for participation and accountability, and the allocation of adequate resources to enable each of these efforts. Accountability must be at the foundation of the ICPD beyond 2014 and post-2015 development frameworks. In line with the UNECE Regional Youth Call to Action and the High-Level Task Force for ICPD policy recommendations for the ICPD beyond 2014, governments must undertake measures to systematically address root causes of inequality and social exclusion, paying particular attention to the needs and realities of marginalized individuals. They must also meaningfully engage the most marginalized, including sex workers, migrants, individuals with diverse sexual orientations and gender identities, adolescents and youth, persons with disabilities, and others. Governments must also ensure that laws, policies, and programs related to adolescents and youth are developed in line with their evolving capacities and with respect for their human rights. Finally, governments must revise legal and administrative requirements for parental, guardian, or spousal consent for sexual and reproductive health services such as contraception, abortion, and HIV testing and counseling, and statutory rape laws. Thank you.
Thank you. Thank you for your statement. I now give the floor to the International Planned Parenthood Federation European Network.
Thank you, Madam Chair. The ICPD Plan of Action was and is still a milestone, as it underlines the interrelationships between populations, sustained economic growth, health, education, economic status, and empowerment of women. It was the first time world leaders agreed to invest in people and not so much in demographic targets. Unfortunately, in the Europe region, many governments considered that the ICPD Plan of Action was meant for developing countries. It has taken a while before this region got into action. Because of the survey, we know that progress is made, but also that there are still outstanding issues. IPPF European Network is since long active in the region and has in many countries been helpful in the creation of NGOs, particularly in Central Asia, the Caucasus, and the Balkans. IPPF is an SRHR organization, but definitely also an expert in organizational development with a focus on good governance, good management, transparency, and accountability. Being part of a global organization, we experience the need to increase efforts to explain better the SRHR situation in this region. The countries in the region are either donor countries, middle-income countries, or emerging economies. But it is clear for those working in the field that the growth in GNP is not good enough as an indicator. Inequality is growing in almost all countries, and those that are become rich have access to all they need, and those that are poor become poorer and risk of falling out through the safety net, if there is one. This reality is not sufficiently recognized and poses a threat for the future. While most of the development cooperation aid goes to sub-Saharan Africa and Asia, countries with a high fertility rate, poverty, and a lack of gender equality, the situation in Europe and Eastern Europe, Central Asia, is often not recognized. Donors are leaving the region, including the Global Fund, who is at this stage perhaps the largest donor, and in many instances governments are not able to take over the role the Global Fund played. We will see a large number of NGOs disappear, and much worse, people with HIV risk to be left without treatment, not to mention the necessary prevention. A lot has been achieved, but the question now is whether that will be sustainable under the new harsh conditions of a region that does not seem to be able to get out of the economic and financial crisis, of which the effect is now hitting hard societies. We do not need a crystal ball to see who will suffer most under this situation. It will be undoubtedly young people, women, and vulnerable groups. We know that women remain largely underrepresented in management and political positions. And with a look at history, we know that when economic crisis hits, that women are the first ones to be sent home again to take care of the children in order to leave the labor market to the men. The fact that it is still more difficult for women to combine work and home life, where women often find themselves to compromise with a part-time job, it is easy to eradicate this element of empowerment and self-determination. The risk of being totally dependent again on the partner is the one providing the money for the household. It's luring around the corner. Girls and women are disproportionately affected by gender inequality and sexual rights violations. This affects their access to endowments such as good health and education, which in turn affects their options and ability to take agency later in life. When girls and women have access to sexual and reproductive health services and information, and when they are able to make meaningful choices about their lives, they are empowered, their quality of life improves, as does the well-being of their families and the communities in which they live. The WHO report on violence against women revealed absolute shocking figures. Violence against women is one of the most pervasive violations of human rights worldwide, with more than 1 in 4 women in Europe experiencing physical or sexual violence over the course of their lives. The endemic level of gender-based violence restricts the ability of women and girls to make choices over their sexual lives, limits their ability to participate widely in the life of the community, and has a huge economic toll on the state. We have heard yesterday many times the need for education and the positive effects it has on a girl's future. Education is extremely important, but it is not and should not be considered as a solution to all problems. Violence against women does not only occur to those with lower education levels. This direct physical violation of women's rights is very often caused by male relatives. It's true that men can also be subject to violation and suffer from discrimination, but it must be said that it is often women who suffer most. We all know what is needed to fully implement the ICPD program of action. The actions needed, the money needed, we know it all. It has all been documented and said in many international meetings, studies, reports, and declarations. It would be helpful if we would be clear on the barriers that hamper women's rights, reproductive rights, and sexual rights to become a fulfilled right to everyone. It's not that much a matter of money, but the need for political will around the globe to consider all people as equal right holders, whether they are male, female, young or old, homo or hetero, black or white, rich or poor. Sexual rights and reproductive rights are human rights, and only by respecting human rights, this world will be a good place to live in for all of us. Finally, I would like just to say 2 words about the Chair Summary Report. Where the UNECE Youth Conference plan of action could have a more prominent place. And secondly, we have been talking about rights all the time, and it could be strengthened in that way as well. Thank you.
Okay, thank you. Thank you. The representative of the former Yugoslav Republic of Macedonia has asked for a 1-minute statement. You now have the floor.
Mr. Chair, I would like to make intervention regarding the statement from the session where the representative from the Federation for Women and Family Planning from Poland in their report mentioned that Macedonia in the adopted law prohibit or restricted abortion. As representative of the government of the Republic of Macedonia, I would like to say that such free interpretation of this law is very harmful for the image of our country, of the Republic of Macedonia, and gives another picture of law as deterrent law. We didn't prohibit or restrict abortion, but we have introduced a procedure which goal was to ban illegal abortion with primary function of health protection of women as a pillar of the family and society. Our procedures are not something new. Those were also in the elder law, but we introduced the terms in which runs abortion and with prior consultation with the gynecologist, which is essence of this law. To mention, our aim is not to prohibit or restrict abortion. Our aim is health protection of women as a pillar of the family and the society. Thank you very much.
Thank you for your clarification. And our last speaker is the Turkish Family Health and Planning Foundation. You now have the floor for absolutely 5 minutes.
Thank you, Madam Chair. I'd like to talk on behalf of ICPD Plus 70 platform of civil society in Turkey. I'd like to readdress a few points. Sexual and reproductive health and rights are human rights first and foremost. They are also essential foundation for building just healthy and vibrant societies and economies. Despite the progress in the ECE region, these essential aspects of human rights and human dignity are too often ignored, neglected, or violated. All social and economic initiatives which support sustainable development should be in compliance with globally agreed human rights. 1994 ICPD Program of Action led to the inclusion of social and welfare policies covering vulnerable groups, including women, youth, specifically girls, children, older people, migrants, people with disabilities. It has also led to many legal changes in CHR to be included in population policies. However, this is an unfinished agenda. There is a need to further revise, enact, or repeal law and policies to respect and protect sexual and reproductive rights. The increasing attention to population growth and decline in the last years might have the potential risk of losing the initial right-based focus of ICPD. The MDGs are also not grounded in the right-based approach. Instead, with an overemphasis on targets and indicators of simple numbers, including for women, youth, older people, LGBT, sex workers, and migrants, all countries should respect, protect, and fulfill sexual and reproductive rights of these groups. To strengthen equality and the protection and fulfillment of the sexual and reproductive rights, gender stereotypes and discrimination in relation to sexuality and reproduction, harmful practices such as early and forced marriage, all forms of violence against women and girls should be eliminated. Violence against women and girls is a persistent and universal human rights violation in the world. Even if new laws and policies have been adopted in many countries since 1994, much more needs to be done. Many women and girls do not have any access to protection from violence against women and services in many countries, even if laws exist, violence against women. Access to safe abortion has been increasingly recognized as a matter of human rights and public health. Yet, many barriers continue to exist. Thus, structural, legal, policy, regulatory, and social barriers to abortion services, including mandatory waiting periods, mandatory counseling, requirements for spousal and parental notification and consent, should be removed. Thank you.
Well, thank you for your statement, and thank you to all participants for their interventions. Let me now give the floor to the keynote speaker and the two discussants to please very briefly react to the various comments and interventions, and also please see if you could formulate one or two clear recommendations to address persistent issues in the context of our session themes. We start with Madame Bousquet.
Merci. Je vais de nouveau parler en français. Les tendances mondiales actuelles peuvent laisser croire que la pauvreté s'est réduite partout dans le monde depuis 20 ans. Mais des écarts importants continuent à exister entre les pays, bien sûr, mais aussi très largement à l'intérieur des pays. Et c'est ce qui nous a été dit tout à l'heure sur le fait que d'ici 2050, 1,5 milliard de personnes de plus naîtront ou vivront en Afrique, dans ce continent où il y a la richesse la plus extrême, mais aussi la pauvreté la plus extrême, où les droits sont les droits humains, les droits des femmes, les droits sexuels et reproductifs sont assez peu existants. Je crois que ça montre à quel point il est urgent que la communauté internationale se mobilise pour qu'il y ait un réel accès aux produits et aux services de planification familiale. 1,5 milliard sur un continent qui porte l'extrême pauvreté, ça n'est pas sans nous inquiéter. Le défi qui nous attend, à mon sens, en Europe, dans l'architecture du développement post-2015, pour moi, c'est le suivant. C'est d'avoir une approche réellement transformatrice qui viserait à réaliser d'abord l'égalité entre les sexes, des droits humains universels et une nouvelle approche du développement qui nous différencie de notre mode de croissance actuel, qui est pour l'essentiel la cause de la crise financière, des crises économiques, des crises démographiques, des problèmes sociaux et des problèmes environnementaux. Et je crois que c'est vers un nouveau mode de développement, effectivement, qu'il faut s'orienter. Prendre conscience du fait que les enjeux de population et les enjeux d'égalité entre les femmes et les hommes sont ce que j'appelle les leviers oubliés du développement. C'est-à-dire qu'on n'a pas suffisamment axé le développement de nos sociétés, le développement du monde, sur le fait que l'égalité femmes-hommes et le bien-être de la population était essentiel dans le développement mondial, aussi bien dans nos politiques nationales que dans nos politiques de coopération et d'aide publique au développement. Je crois que ça implique deux choses. La première, c'est qu'il faut que partout, dans tous les pays, on mette en place des structures de concertation avec la société civile. Et la deuxième chose, c'est qu'aujourd'hui, une mobilisation politique est absolument indispensable au plan international pour que la CIPD plus 20 soit intégrée dans l'agenda du développement post-2015. Merci.
Je vous remercie, Madame Bousquet, et je donne maintenant la parole à Madame Kladieva.
Very much. Just one brief, concrete recommendation. It is related to the issue of gender-based violence, which we heard a lot about this afternoon. And I'm calling on the governments present here, because most of the countries being part of the UNECE region are state parties to the Council of Europe. Please sign and ratify Convention 210, the new legislation available on prevention of and fight against all forms of violence against women, including domestic violence. That will work. Thank you.
Je vous remercie pour votre intervention. La parole est maintenant à notre troisième intervenante, professeur Beck.
Thank you. It was very interesting to listen to all the interventions from the floor. It's clear how strongly we all share the ambition and aspirations towards greater equality. But it's not enough just to have those ambitions and aspirations. And indeed, it's not enough to have laws, policies, or international conventions and agreements. We need a system, a framework that has concrete goals so we can measure and monitor progress. So as well as needing a new paradigm for development, which I mentioned earlier and Madame Bousquet mentioned just now, which places well-being for all at the centre, it's really important that, as Bruce Campbell pointed out earlier, we have disaggregated goals for development in the post-2015 framework so that we can see whether or not countries are providing for those at the bottom as well as those at the top, those who are excluded as well as those who are not, those in the minority as well as those in the majority. And in addition to those disaggregated goals, we need goals within each country. These should be part of any post-15 development framework to actually reduce the gap between rich and poor in societies and across the world. Thank you.
I thank you very much, and all three of you for these wrap-up statements. Just 3-4 key points before our rapporteur takes over. First, I think this session has really clearly identified our common understanding of the numerous and often overlapping underlying causes of inequality and exclusions. Interventions this afternoon have identified several systemic barriers that impede far too many women, children, young people, people with disabilities, with ethnic and other minority groups, people living with HIV, to be protected from poverty, violence, and abuse. And we have heard very clearly that the promotion of gender equality is key in tackling other inequities. These issues require urgent attention from policymakers the world over because they are relevant everywhere, building on the many positive steps that were shared by participants today. My second point is that the compounded vulnerabilities that women and other groups face are simply not acceptable, that social policies must be reformed to broaden access to social benefits and services, with efforts intensified using a rights-based approach to reach the most marginalized individuals and communities, change social attitudes, and enforce anti-discrimination legislation. Third, we heard about investment in health and education that have very high returns not only for individuals but for the entire society, and that building up and protecting the human capital starting in the earliest years contributes to breaking the transmission of poverty across generations. This will contribute to a more just, prosperous, and resilient society. And then finally, a call for adequate financial and human resources and knowledge to implement agreed priorities and track progress in closing the equity gaps. I think the interventions today clearly called for closing the equity gap as an essential component of the ICPD agenda between 2014 to put societies on a course towards gender equality, women's empowerment, and sustainable development. And with this, I turn over to our rapporteur to capture the other elements of the very rich interventions today. Professor Hobcraft, you have the floor.
Thank you. As always, it's a challenge. I was thinking back to Cairo and the chapter title on gender equity, equality, and empowerment of women. We've sometimes, I think, blurred equity and equality in these discussions. I mean, to me, the achievement of equal rights is about equity. The achievement of equal opportunities is about equity. Our intention in doing that is that we achieve greater equality. So I think it's worth thinking about that. Now, it's hard to point to successes in this area, and there's been a lot on the huge needs for sexual and reproductive health and rights. I think the thing I'd want to pull out on that is the concerns about the interplay in both directions between inadequate sexual reproductive health and rights and between equity, more inclusive societies, social inclusion. And I think we want to frame things in that context. In terms of successes, I find it hard to put my finger on successes. I mean, I think there are areas where we're making progress, so I'm going to go for that. We are making some progress in removing discrimination on partnership, race, gender, family. We are making greater investments in health and education and sexual and reproductive health and rights. We're making some progress with including and reducing the barriers for young people. We're making some progress in including civil society, in rights-based approaches and fights with legal authorities that Milena talked about to use instruments to improve the rights-based approach to sexual and reproductive health. We are slowly making some progress on gender-based violence, and on gender equity, but on all those, there's a long way to go. So, my list of challenges includes all those topics too, and recommendations, I think, need to include all of those. There is a need to fight against inequality. It's not something that just goes away. All societies are unequal. Some societies are successful at making themselves more unequal. Very few societies are successful in transforming themselves towards greater equality. So it is a fight. In Cairo, we emphasized the empowerment, equity, equality issues for women, the gender issues. We also did touch on many of the other vulnerable groups, but I think it is key today to be talking in the context of other marginalized groups as well. And we've heard the young, the old, the disabled, migrants, sex workers, orphans, minorities, sexual orientations, gender identities, and so on. We need to deal with discrimination, which is an important part of inequity and source of inequality. We have talked a great deal about the need to combat and have zero tolerance to gender-based violence. But we've also heard today about many other forms of violence against marginalized groups. And I think we have to take a strong stance combating that as well. There are a whole series of issues and challenges about the structures of society. I mean, altering gender structures, altering race, ethnic structures, class structures, religious and cultural structures is always a big challenge, but those structures are very important in reinforcing inequalities and inhibiting progress towards equality very often. We have the context of rising poverty and unemployment, which makes for a bigger challenge because we know that the incidence of those typically does fall upon marginalized groups. I hate really calling women marginalized groups because it's rather a large fraction of the population, but we should mention the gender aspects of that too. Underlying achieving greater equity and equality, we've heard a lot about access to sexual and reproductive health services and rights, about increasing autonomy and self-determination, about the roles of education and comprehensive sexuality education. We've also touched upon family policies and responsibilities and how those can reinforce inequalities. We heard the all too familiar story of the double whammy that faces women in terms of taking the major responsibility for childcare whilst at the same time being key members of the labour force and in terms of income. So that I think we need to touch on. We heard how inequality has a whole lot of negative consequences for society. And we heard a slight mention of something that perhaps hasn't been touched on as often in this meeting, is legacies of sexual abuse or other early abuse in childhood. There are a number of studies emerging that suggest that that really can play a critical role in messing up people's lives, to put it in shorthand. So I think we need to think about that. Now, recommendations, I mean, it's by now pretty obvious, many of the things I'm going to say, but it's probably still worth saying. I mean, that we want to find ways of generating more inclusive societies, greater equity, greater gender equity, emphasizing the rights of women, but trying to achieve equal rights and opportunities for all, whether it be women, marginalized groups by age, ability, origin, class, or whatever. It is a broader picture, and I think we all, because we care so passionately about SRHR, often get too focused on that, but even the Cairo chapter was not focused just on SRHR. So it was much broader in terms of the context of gender equity, equality and empowerment of women. We need, although Kate Pickett says it's not enough, and I'd agree, we nevertheless need enabling laws, policies, services, education to help in this progress, and we need often quite draconian enforcement of some of those issues to change the cultures in societies. Locking up people for gender-based violence is important symbolically, and so I think enforcement becomes part of the story too, but education matters as well in that context. We need concrete goals. We need to set what we're trying to achieve, be clear of what we're trying to achieve in this context, and we had echoed Bruce's plea for disaggregating those goals, disaggregating our monitoring of most things we do, and that reminds us of the plea we've heard quite often for improved data sources to enable such monitoring. We need resources to do this, which is a point our moderator made most forcibly towards the end. We need governments to ratify the Convention on Gender-Based Violence. We need to look at welfare policies and ensure that those are enabling choices and moving us towards equity. We need to do everything we can to promote positive, non-discriminatory roles and attitudes, gender roles, but in terms of dealing with all sorts of other marginalized groups, for men and for women. And I think one of the things we really need to learn is that much of the language in Cairo was in favor of gender equity and saying men should be responsible. I think gender equity actually involves men being involved in positive and creative ways, and without that, these agendas won't be achieved. So there's that need there. Increasing government accountability obviously matters. Increasing research to understand the drivers and, I've nearly finished, and diversity of inequality. Some of these are coming from the expert group meeting. Increasing enabling participation, ensuring that people know their rights, have access to justice, supporting civil society. So, the big story, again, let's get rid of discrimination. Let's try and achieve much greater equity, equal rights, people able to exercise those rights, people able to make choices, to have equal opportunities, to do things to change structures, laws, regulations, other barriers to access to choice in life, and to set clear policy goals to achieve some of those things. I'm sorry if I overran slightly.
Well, I thank you very much, Rapporteur, for this very rich and thorough summary of the various dimensions of what was a very engaged conversation this afternoon, raising many important issues. And I thank every participant for the engagement, for the commitment, and for the real concern that you all shared about the analysis of the situation we face, but also what it is that we need to do to move together this agenda forward. Before I bring to a close the third session, the Secretary has asked for a couple of announcements.
Thank you, Chair. I would like to remind you, you have on your desks the evaluation form. We hear everyone thanks organizers. We would like it in writing. Please fill those evaluation forms. But feel free, express your opinion as you wish. It's one thing. Another thing, we have, the team is working to finalize the chair's summary. And we agreed to extend the coffee break until 5 o'clock. And you will get this chair's summary before the end of the coffee break.
I don't know if it will be 10 minutes before or 15 minutes before. I was not in the room at this very moment. So during the coffee break, the chair summary will be distributed, and then chair will introduce it after coffee break.
Thank you, Madam Secretary, for these clarifications. And I now close the third thematic session and return chairpersonship to our vice chair.
Thank you very much indeed for everybody for participation. We're again quite lucky with our moderator for this session, and for the key speakers, thank you very much for the participants. Just great efforts you've made. Not gonna take any more time of you and let you go for the coffee break. Thank you, everybody.
5 o'clock.
5 o'clock.